distinguishing ocular surface squamous neoplasia from pterygium by various imaging modalities. Although all these 4 lesions came out to be positive for OSSN on histopathological examination, but clinically it is not always feasible to distinguish OSSN from pterygium. The following are the differential diagnosis for pterygium. This is important because OSSN has a protocol-based management which includes margin clearance, cryotherapy and proper follow-up, which if not done will increase morbidity. In this particularly pterygium is important because our country has low latitude and high UV exposure. So we ask the question, can we reliably distinguish ocular surface squamous neoplasia from pterygium by multiple imaging modalities? We did a prospective cross-sectional study. We defined the gold standard for diagnosis of OSSN as typical histopathological features and or showing response to topical chemotherapy. Then we compared the presence or absence of certain known features on the imaging modalities. The known features of OSSN on ASOCT are hyperreflective epithelium and abrupt change from the affected tissue to the non-affected tissue. The known features of OSSN on confocal microscopy are variation in cell size and starry sky appearance. The known features of OSSN on ultrasound biomicroscopy are fusiform thickening and hyperechogenicity with internal hypoechogenicity. The slit lamp examination is assessed for the presence or absence of limbal location, corneal extension, keratin or pigmentation. The red-free filter examination is done to assess for feeder vessels, rose Bengal staining or presence of intrinsic vascularity. We took 18 cases each of pterygium and OSSN. 2 examiner masked to the final diagnosis and each other's findings evaluated the images of the lesions. The lesions were studied under the following headings: clinical examination, red-free slit lamp examination, ultrasound biomicroscopy, anterior segment optical coherence tomography and in vivo confocal microscopy. Each characteristic under a category was given a score of 1 if it was present and 0 if it was absent. The score for all the characteristics in each category was average. The Bland-Altman analysis was done, which showed a good correlation between the scores of the 2 observers. So we did the scoring on slit lamp photography. On clinical slit lamp photography, both OSSN and pterygium showed similar scoring, but on red-free filter examination, OSSN showed higher scores than pterygium, especially on rose Bengal staining and feeder vascularity, which was statistically significant. On confocal microscopy, both OSSN and pterygium showed similar scoring, and on anterior segment optical coherence tomography, pterygium showed a better scoring than OSSN, but it was not statistically significant. Again, on ultrasound biomicroscopy, OSSN showed a better scoring than pterygium, but it was not statistically significant. We observed that only on red-free slit lamp biomicroscopy there was a statistically significant difference between OSSN and pterygium. So we concluded that meticulous slit lamp biomicroscopy, red-free filter examination and rose Bengal staining is more effective in differentiating OSSN from pterygium than confocal microscopy, anterior segment optical coherence tomography or ultrasound biomicroscopy. Here are my references. Thank you.